right, so it is my great pleasure to introduce our next panel presentation called How to Engage with Family Organizations in Clinical Care. And our two speakers are Molly Martzke and Jeannette Mejias. Molly brings passion and real-life experience to her role with the National Genetics Education and Family Support Center, where she serves as the Senior Program Manager. Molly also has extensive experience working with diverse groups from local to international in providing family leadership training. She has dedicated her life's work to improving the experiences and outcomes of all families with children with special healthcare needs. Jeannette is a New Jersey Lend Family Fellow from 2016 to 2017 and is currently the project director of the Special Education Volunteer Advocates of the SPAN Parent Advocacy Network, funded through the New Jersey Department of Education. She leads a diverse team and has trained over 220 volunteer parents across the state to serve as mentors to families who are looking for support to advocate for their children and youth for special healthcare needs at Individualized Education Program or IEP meetings. So NIMAC has been fortunate to have a long-standing collaborative relationship with both the Family Center and SPAN New Jersey by working together to assist families in our own unique capacities. So thank you both for joining us, and take it away, Molly and Jeannette.
Jeannette, and just a tech note, Jeannette, as soon as you're able to start your video, then I'll bring you up on the stage. But Molly, if you unmute yourself, we'll all hear you.
Are you able to hear me now? I had to call in. Yep, thank you, great. My internet connections is a little bit unstable, so I am on the phone, but yeah, I'm super excited to be here, and I hope my co-presenter Jeannette is here with me as well.
Otherwise, I am here.
Okay, great, Jeannette. I just wanted to take a few minutes to say thank you and welcome you to our presentation. I again am Molly Martzke. I'm the Senior Program Manager with Expecting Health, and there I manage the National Genetics Education and Family Support Program, which we like to affectionately call the Family Center because the rest of that is a huge mouthful to say. And I will spend just a few minutes highlighting the work that we do at the Family Center, which tends to be at that higher level, system level, and what we do there. And then Jeannette is going to walk you through and spend some time talking about the work that they do at SPAN at that local level. She'll highlight some of the resources that they've developed for parents and how they've done some of that work, so that really to give you some ideas on opportunities to engage with families. We say that the opportunities honestly are endless, that we can go through any of that. But Jeannette, were you going to share your screen with the PowerPoint slides?
Yes, I'm trying to share it, but it's saying to start my video, and the challenge I have is when I open up the video, I am having internet where it's dropping. So I'm not able to go on camera live without the internet. I have a lot of interruptions, unfortunately. If someone can make me a co-host, I can share my screen and we can populate our presentation.
All right, I've gone ahead and done that, Jeannette. Let us know if that works.
Okay, great. Thank you so much.
So while Jeannette's figuring that out, I'll just, like I said, I'll go ahead because I know our time is short here, and I just want to make sure that we get the opportunity. But when Jeannette shares our screen, you'll find out that we do not have any financial interest. I don't remember the full disclosure, but we have no disclosures to make on any of that. Awesome. Thanks, Jeannette. I can see that now. And like I said, the Family Center is a HRSA-funded program. So there's our disclaimer with our program number and stuff like that. So just to let you know about that. But Jeannette, if you can move to the next screen. So the Family Center, it works, being a HRSA funded project, we are part of a group of 3 programs that are funded through HRSA. So there's the National Coordinating Center, and then there's the Family Center. And then there's the other piece of that, which is the 7 regional genetics networks, which NIMAC is one of those. So what we do is between the 3 of us, we're looking to create this system of care for families and really try to ease their entry into that genetics healthcare system, as well as, you know, making that journey better for families, I guess, as we go along. So at the Family Center, we do that in several different ways. We help to provide some online access to family-oriented genetics and genomic services information, including the opportunity to connect with others and advance leadership skills. So the way we're doing that currently is, and I had hoped to have it ready by this week, but it's not quite there. We are developing a new website that will house all of the Family Center, include information on genetics that families need to know, as well as highlight and collect family resources that have been developed within the 7 RGNs, and that piece about the leadership skills as we look to empower families on their journey. We work with a diverse set of partners and experts to help develop these trainings and, you know, that are tailored for the involvement of leadership in the RGNs and the genetic system. So there is a lot of, I shouldn't say a lot, but there are some family trainings out there that maybe aren't particular to our genetics network. So we really look to create and understand what families going through this healthcare system and this delivery system need to know and understand. And so we look to develop those trainings in that way. Our diverse partners, we have lots of partners that we work with. The Family Center in particular has an advisory committee that's made up of family leaders from each of the 7 RGNs, as well as a member of our work group on inclusion. So we have a work group on inclusion that we work to, you know, help. We don't call it diversity, equity, inclusion, even though that's a main part of it, but really because our ultimate goal is inclusion, we say that we want individuals to be, you know, included in every step of that process from diverse backgrounds. And then we have create educational and awareness building materials. So we host webinars that, and we'll be hosting some more in the upcoming, our program year begins June 1st. So in this new year, we've got a lot of stuff slated as around leadership trainings and what families need to know. We have some that we're getting ready to release this month around family history, as well as families entering the process through screening and what the different screening is and what those mean, as well as, I forget, there was 3 though. But anyway, so those are being developed and will be out this month in May. And then again, we're looking to really on that system level work to ensure that families are meaningful participants in the system. We're looking at family engagement measures specific to this genetic services. So we're really looking at what does family engagement look like within the regional genetics network. So next slide. And again, here's just a couple of program highlights that we have for you. So, you know, we're really looking, you know, one of our main goals, I would say, is we're looking to increase the number of individuals or families that with or they're at risk for a genetic condition, that they have access to genetic information and links to services and resources. So we're really looking to make sure that families have that unbiased, that they know where to go, so that they have that good connections and they're able to get the services that they need. We're looking to create a leadership curriculum. So this will allow us to train family leaders so that they really can be those active participants in the system and help to improve that system as stakeholders to get us all to a better spot. We're looking to, create opportunities for families from underserved populations so that they're trained as family leaders. And we did this on our work group on inclusion, as well as we've developed a community of practice on diversity and equity inclusion. So our work group is a little bit more focused. They'll probably have some direct trainings or materials or resources developed, whereas our community of practice really looks to be opportunities for family leaders to get together and share things that are happening or things that they know about or articles and stuff like that to further their knowledge base. And then lastly, we're really looking to increase those meaningful roles in the RGN programs by providing opportunities for connections. So for example, if NIMAC comes and says, hey, we're looking for some family leaders to serve on one of our groups, or we need family leaders, we're looking for family perspective on this, the Family Center is really looking to be that place to provide and help facilitate some of those connections. Next slide. Like I said, we do have, we couldn't do this work without a lot of individuals involved with the Family Center, but really we have two main partners in this program, and that is SPAN, the Parent Advocacy Network out of New Jersey, as well as Parent to Parent USA. They both bring some different perspectives, and they both have access to different family leaders throughout the country that we can rely on. And the last slide. So there's my contact information. I'm happy to talk with anybody about the Family Center, or if you need more information. Some ways you can stay connected. You can follow us on any of those social media. So that's where we'll be releasing once our website gets launched again in the next week or so, as well as any webinars that we have that we're promoting and stuff like that. So we hope you connect with us through that. And I'm going to turn it over to Jeannette. And like I said, she is going to give us some good examples of ways that they have worked with families and professionals, sort of that I kind of gave you that overview of how we're doing it at a bigger, larger system level. And Jeanette's going to spend some time showing how they actually have done that at that local level and national level too. So thanks, Jeannette.
Great. Thanks, Molly. Welcome, everyone. I'm going to go ahead and talk about SPAN and what we offer in terms of resources for families and professionals in our state in New Jersey, as well as nationally. So I'm really excited to be able to co-present with Molly here today. So I'm going to talk to you what SPAN provides. SPAN is a family-led, and we're a family-serving organization that's federally funded by the U.S. Department of Education, Office of Special Education Programs, and we also have HRSA and maternal child health as our partners as well, and funded through them. And they house our Parent Training Information Center. And so we provide family and professional development, individual assistance, information and resources, and advocacy and support to New Jersey parents of children ages 0 to 26, youth and young adults, and the professionals who serve them. And we also provide assistance to family-led and family-serving organizations, parent centers, and family to family around the country. So we help family-led and family-serving organizations more effectively reach and serve diverse families, partner with state and other agencies and other effective nonprofits. SPAN's mission is to empower families and inform and involve professionals and other interested in the healthy development and education of children to enable them to become fully participating and contributing members of our communities and society. So SPAN is considered our New Jersey's one-stop for families. And our motto is empowered parents, educated, engaged, and effective. Our foremost commitment is to children with greatest need due to disability, poverty, discrimination based on race, gender, sexual orientation, language, or immigrant status, involvement in the child welfare or juvenile justice system, geographic location or family or other special circumstances. And so we as a family center and parent-led organization, we seek to provide information, resources, and support and leadership development to families in New Jersey. And these are just some of our issue areas that we work along in the areas of education. We work in school reform, special education, Section 504, high expectations for all students, and parent and family involvement. In the area of health, ensuring that there's quality health care, health coverage, early intervention, preventative services, health partnerships. And in the area of human services, having family strengthening, child welfare reform, child care, Head Start, after school care, mental health services, abuse and violence prevention, civil rights for children with disabilities, and we ensure to educate folks in the area of no restraints or aversives. And so as you can see, being partnered with a parent center or family-led organization is really important because we really are the front runners in terms of working with families and professionals. So we have quite a bit of activities. We bring a lot of information. We gather thousands of families that we work across with systems to policymakers, government office, commissioners, to ensure they're aware of what is happening to the families on the ground. And further, we support and train families to bring their own stories to the policy arena. So in our policy work, we focus on equity, effectiveness, meaningful engagement, and leadership. I'm not going to spend too much time on this slide, but this is just an example that what we provide is technical assistance to family organizations. So we're on a national level providing technical assistance to the Center for Parent Information and Resources, RAISE, Leadership and Family Professional Partners in collaboration with Family Voices, and we're also on a regional level as well. And I'll get further into that along our presentation. The Center for Parent Information and Resources, we provide rich website, including resources collections related to COVID, race, Native American, and military, and you can visit the website, parentcenterhub.org. And we also provide Parent Center, e-learning hub, Buzz from the hub, e-newsletter. And so we do quite a bit, as you can see there. So we also provide technical assistance to RAISE, which is our National Transition TA Center. Again, providing those resources, rich website, where you see listed here. We provide direct technical assistance to 8 regional and parent centers, including the Real Transition Partners. And we serve 2 different regions in A1 and A2. We provide universal technical assistance to all 96 parent centers. And we also provide e-newsletter, an annual transition summit, and we also have webinars as well. Leadership in family and professional partnerships. So we have a collaboration between Family Voices. We provide TA to 59 family to family health information centers, maternal and child health programs, and others. And we also provide a very rich website that can be accessed as listed. And we have a listserv. We also provide webinars, annual family, professional, and partnerships, and state collaboration action team process, and peer-to-peer TA. So in the regional for NEPAC, this is just an example of what we do and as we work with NEPAC, and we provide targeted intensive technical assistance and for 26 parent centers in 11 states, including DC and 2 territories, which is Puerto Rico and the US Virgin Islands. And again, we provide a range of resources, including monthly newsletter. We do drop-in calls, which is 2 times a month. And one is focused on the COVID response. And we have site visits, strategic planning, retreat facilitation. And so as you can see, we do quite a bit, and it's so important to partner with your parent centers. I mean, although SPAN is on a local and state and national level, but even just partnering your parent centers within your state, they can really offer you so much assistance in the area of working with family leaders.
Hey, Jeannette, it's Molly. Why don't you just, some people might not be familiar with when you say a parent center, what that means, or how they maybe even could find that.
Yeah, sure.
Can you just
Yeah,
a brief, like couple sentences. I just want to make sure that,
yeah, sure.
again,
That's
that
a
if
really,
people are looking for that. So
yeah. So it's really important that everybody understands that in every state there is a parent center, and a parent center, like I say, the best way that I can explain it is when folks hear about SPAN, Parent Advocacy Network, everyone wants to know, how can I find a SPAN in my state? So SPAN is considered a parent center. And so if you go to parentcenterhub.org, and you actually can find your parent center would be listed in that website. And that's where you can link to your parent center, where you can get technical assistance in the area of education or health advocacy. And that's how you can link to your parent center. I most certainly can put that in the chat box as well, but it is referenced. Actually, it's going to be referenced out on the presentation. And it's also referenced in the slides prior. So you want to really connect to your the center, the parent center hub. That's how you find out where your parent center is. And I hope that clarifies. And thank you for pointing that out to me, Molly. I appreciate that.
that's okay. I did put the link in the chat, and
Excellent.
I just wanted to make the point of, sometimes professionals have their own jargon, that sometimes families have their own jargon as well.
Absolutely.
So
Yes.
we just want to make sure everybody knows.
Yes, everybody knows and they understand. Absolutely. And so SPAN, we have affiliates of national organizations. So we're affiliated with the Family to Family Health Information Center, Family Voices affiliate organization. So as you can see, we have a lot of affiliations across the state in New Jersey. And then this is just an overview of some of the based projects that is housed in SPAN. So SPAN, again, going back, SPAN is a parent center, right? We're the only one here in New Jersey, and there's one in every state. And so in our particular parent center, we have all these programs. And this is all as it relates to working with families. So the child welfare peer program, the military family support 360, where we offer support to families who are in the military. So they're on a military base, and we provide TA because that's that particular population has different resources and level of supports that they require. And I'm just going to highlight one or two of these programs. And so Family Wrap, that is through the Department of Health, where we have a family resource specialist that is providing wraparound services, whereas supporting families meeting them where they're at, but also providing them parent-to-parent support. And they are actually housed in special child case management unit. And then we have to learn the signs act early, which I'm going to talk a little bit more about those resources that are offered to families on the early childhood portion. And then special education volunteer advocates, that is a peer leadership program where we train up parent leaders in the community to take a training to offer support to families in terms of IEP meetings. And so this is just to give you a little idea of what we do at the center. And then here's information how you can access. So remember I mentioned the parentcenterhub.org. If you want to know who is your parent center and you want to connect, and I really encourage that you do go into this website to find out who is your parent center in your state. That would be really helpful for you so that you can make those linkages, you can connect, get the support that you need. And also your parent center will serve families as well as professionals. So for the example, with Molly having the partnership with us, in terms of her looking for leaders, family leaders, well, we engage with families in all levels. And so we're able to partner with Molly to be able to help her identify some family leaders who are on the ground, who are serving on advisory boards, or even doing some of the work within our center so that they can be identified to work alongside with Molly or participate in her initiatives. And so that's just, again, just information how you can access SPAN. So we have health information tools. And so we provide fact sheets and information packets on education, health, mental health, and human services. We also have a child health passport and child development parent engagement cards. We also have a shared plan of care, and that is something that was developed through our partnership with the Department of Health, where we had pulled together a group of families in the community that had children with special health care needs, and we did a focus group, and we wanted them to really contribute in creating this shared plan of care. And it was really through the contribution of the family voice and what they imparted with our group is how that plan was shared. That's a plan that you can also access on the Department of Health website, but it is based in New Jersey. But any state can really adopt that same model. We also have health advocacy across the lifespan. It's a booklet that provides information to families, providing them linkages and resources. And then we also have a transition guide, transition to adulthood, and healthcare financing fact sheet series. I do want to also mention we do have a community of consortia meeting, which is held quarterly, where we invite community partners, stakeholders, family leaders, anyone to come to the meeting, and they can really engage in meaningful conversation to really address all the areas of health, including medical home, or they could sit in a work group to participate and really give us their feedback. So these are just some of the trainings that SPAN offers. We do individual workshops right now. We are doing lots of virtual workshops. And so these are just different ways that you can access SPAN. I think I skipped one. Sorry about that. We also have parent leadership development. So I did mention some of the projects. This is really dedicated to parent leadership. So learn the signs, act early, parent ambassadors. So we have families are part of that initiative, whereas families that have children who from birth and early on, from 0 to 5 years of age, that can really contribute um, to the work in early childhood development. And we have Parents as Champions for School Health, which is a training for parents to really be effectively engaged with their schools and really having that conversation and ensuring that they're part of advisories and having that conversation about healthy schools and meals and so forth. Then we have SPAN Resource Parents and SAVA, which this is a training that is comprised of a total of 15 weeks. The SPAN Resource Parent training is 10 weeks and the SAVA is 5 weeks. And it's just really teaching parents, professionals, anyone who has a vast interest in improving the healthy development of a child or getting involved in advocacy. We provide an intensive series that is now delivered virtually. And then we utilize those graduates to really assist us in the work that we're doing. SPAN did not come to this place without the servanthood of parent leaders and those who follow us and are alongside us. And so we're really grateful for that. We also have Serving on Groups, a training that is for parent leaders, and Leading by Convening, which is for conveners, which means it's for stakeholders, community partners, and how they can convene and really rally, or for lack of a better word, really get those to the table and how to invite them for those pressing issues that you have within your state, those causes, those burning things that are happening that you want to convene everyone together. So we also provide professional development, and these are just examples of workshops that we offer to families and professionals, including positive behavior supports, children with dual diagnosis. We do a training on medical home where we go into practices that have an interest in being a medical home, and that's a partnership with the American Academy of Pediatrics, and where we will go in and ensure that they have all the great resources that could be available to families that have children with special health care needs, ensuring that they have the right resources such as early intervention poster boards around the waiting area, so that families, have resources that they can obtain in their practices. We have parent-led screening, also where we have parents share their story to medical practices when children have failed screenings or perhaps were not referred to early intervention. And so that really is why we do these trainings, so that we can continue to build that capacity in the community. And then red flags in child development. We also provide a mentor family matching. It's opportunity to see challenges and obstacles that families with a child with special health care needs face. So this is part of the New Jersey Lend with the Boggs Center's Leadership Education and Neurodevelopmental and Related Disabilities Program. And it's part of a national network of Lend programs. And so we're a part of that. And New Jersey Lend prepares the graduate level health and allied health fellows to provide that high quality, interdisciplinary and family-centered, culturally competent care addressing the complex needs of children with autism or related disabilities and other maternal and child health populations. And so SPAN has a unique collaboration with the Boggs Center and recruits the mentor families. So we're part of that recruiting process who are interested in this parent leadership opportunity. So we offer individual assistance, mostly, of course, virtual due to the climate that we're in, but they can also access us in our warm line. But we do provide assistance to child care centers, healthcare professionals, and pretty much everyone in the community. And so we also provide support through our New Jersey statewide parent to parent. We have family resource specialists, which I mentioned briefly in our previously in one of our slides. And they serve as a great resource to families because they are partnered with special child case management units and providing those supports to families who are registered in the unit. And again, these are just more support services that we offer families. We also offer video and webinar archives related to these topics, which are really important for our families, and you can access these recordings at any time. We have early intervention step-by-step, inclusive childcare, and special education frequently answered questions, which is probably our most popular one. And it does change time to time, given the climate that we're in with remote learning and instruction. So we try to be really diligent to have all this information up to date for our families and our, our partners. And we offer transition to adulthood, which is a track, and we have different recordings listed here, talking to your child about their disability, assistive technology and transition, navigating sexuality. And so all of these you can access in our SPAN website. So we're, very diverse. We have 65 full-time and part-time staff who speak 11 languages. We're housed in we serve 21 counties in the state of New Jersey. And so we're, comprised of 200 SRP volunteers. We have 350 support parents, which means they are assisting parents in need of support, whether it's one-to-one or needing support at IEP meeting. We have 600 plus parent leaders. And then I talked a little bit about the Community of Care Consortium, where we have 200 plus organizations and individuals that participate in that consortium. And I'm just going to briefly do an overview of the CDC's Learn the Signs Act early activities at SPAN. We have some really great resources to impart. And so this was a fact sheet that was developed and promoting developmental health for young children and their families in New Jersey. And so this is really a great example of how we collaborate and share this information with our community partners and with our families. And so this is just an example of what we share, and it's really great because it gives the why, as well as how the Learn the Signs Act Early Ambassador Program, how it helps improve early identification in our children. And so this is part of the Help Me Grow initiative. And so this is just a tool that we share with our families. And so really the goal is 4 steps of early identification of developmental delays and disabilities. And the goals are listed. 1 is parent engaged developmental monitoring, general developmental and autism screening. And these, and again, this is the goal of the ACT Early Ambassador: referral for early intervention services, receipt of early intervention services for children birth to 5. And this really is to advance the promotion and distribution of existing and relevant tools and materials and programs to improve resiliency among families with children, young children during COVID-19 response and mitigation efforts. And so this is just, they go everywhere. So these are just examples. They have books, balls and blocks, events at child care resource and referral agencies statewide. course, now the climate that we're in, that's not really occurring. So we're hoping that we can have the Learn the Signs, Act Early ambassador champions to be able to get back to those family success centers, the libraries, and other community-based organizations to really bring this information forward to families, especially those with the greatest needs. And so this is just another tool that was developed, the Child Developmental Passport. This is so critically important. It's in English as well as in Spanish, because we have noticed and recognized in our state, in New Jersey particularly, that there has been a lot of children that have had diagnoses and have missed a lot of their milestones, and families didn't know what to look for. And so this tool really helps families really track that monitoring and screening process. And that's really the role of the Act Early ambassador, who will share that with their families, or really in the community and partners everywhere. And this again, it's just a visual. I know it's not, it's probably doing you a disservice, but these are just handouts and a visual that we offer in the community so that families are aware of what stages that the child should be reaching their milestones in a glance, 6 months to 4 years. In a collaboration project of the Rutgers, New Jersey Medical School and SPAN Parent Advocacy Network to promote autism awareness in the Newark area. So this is another initiative and goals. We also have parent engagement cards. They're based on New Jersey's birth to 3 early learning standards. And again, it's in English as well as in Spanish. And we provide strategies for parents to use every day with their young children to help support their healthy physical, emotional, and mental development and well-being. This is just, yes.
We just have just a couple minutes, like maybe a minute and a half. So I just wanted to make sure you saw that.
Yeah, unfortunately, when I'm in a shared screen, I don't know the time, but we're just about wrapped up. I'm just going to just close it out, only because I know everyone does have the PowerPoint. So these are just for reference of some of the tools. This is a great tool that was developed. It was color coordinated so the families could be able to really identify when they had concerns, but it's based on county. And that's another tool that's also available to our families as well, again, with the color coding, as well as in Spanish. We have everything in English and Spanish. And I'll close it out with this slide. I thank you. I know it was a lot of information. I apologize for that, but we wanted to let you know that not only is SPAN a one-stop for families, but I want you to recognize that your parent centers in your state as well serves as that one-stop for all families as well as professionals. Thank you.
Thanks, Jeannette. That was really easy to close that up so quickly. So thank you. I appreciate it. And I know Pat, we don't really have any time for questions, but Pat put Jeannette and my email in the chat box. We would be happy to talk to anybody after the presentation if you had any questions, and make sure you follow us on social media or sign up for our e-newsletters and stuff like that, and stay connected to some of the work that we're doing. Thanks, Pat.
All right. Well, thank you both, Jeannette and Molly. That was fabulous. Just a wealth of information. So I guess I will turn it over now to Luba, who is going to introduce our next speaker. So thank you both.